you for my colleagues. I'm very happy to be with you today. Really, I'm very happy. I have this subject, and it is very suitable to be after Dr. Rubanda, because it's related to something strange in the nose. Let's proceed to our case report, which is the nasal tooth. Okay. If you want to talk a little about the background of such conditions, nasal tooth or tooth enclosed within the nose, making something like a granuloma, is something surprising. Thinking about the dangerous cysts, thinking about other cysts, let's talk in details later. But in general, the ectopic position of teeth is a common condition. It's approximately about 3%. Presence of teeth have been reported in ovaries, tests, and even the mediastinum, and the head and neck anatomical region, like in the maxillofacial region. Sometimes they are found in the maxillary sinus, mandibular condyles, chin, and the nose. And even some cases were discovered in the orbit. Approximately 50 cases of a tooth in the nose cavity, in the nasal cavity, have been reported in literatures. However, an intranasal tooth in case of cleft lip and palate is comparatively rare. Okay. Again, if we want to talk about the etiology of the nasal tooth, it's really uncertain or unclear. Many theories are talking about, including developmental disturbances, infections, genetic factors, trauma, crowding of dentation, cysts, resistant deciduous teeth, or dense bone. This unusual situation should be suspected in patients with nasal obstruction and unilateral fetid purulent rhinorrhea. The teeth may be asymptomatic or cause a variety of signs and symptoms, such as facial pain, nasal obstruction, headache. In some cases, it can cause epistaxis, foul-smelling rhinorrhea. In severe cases, it can cause nasal deformities, and in very few cases, nasal duct was affected by obstruction and something like epiphora. Okay, our case today. I want to slides. Sorry, it was something with the connection with me. I'm sorry. Again, complications of nasal tooth include rhinitis, scasiosis, septal perforation, aspergillosis. It is a very good media for fungal infection, and this was another study was done about the incidence of sinusal aspergillosis, and we found foreign bodies and even tooth in many cases. Diagnosis of nasal tooth is made on the basis of clinical and radiological findings. The nasal teeth appear as radiopaque, of course, could appear as a radiopaque shadow, and with some other positive data in the CT scan. Okay. Next slide, please. My next slide. Okay, our case. Our case. This was 60 years old female. 60 years old female. Really, it was living in rural area, like an oasis in the desert, away from the good hospital and medical care. She was diabetic. Her diabetes was not controlled. She came to the clinic with a long history, about 2 years. She was neglecting her complaint, and she was not clear in explaining the complaint. So the history was vague. She had stationary course fright nasal obstruction. But the obvious feature is the fetor and the mucoid discharge. Really, I didn't get too much from the clinical examination. Just congested mucosa, enlarged turbinates, and scanty discharge. Actually, I shifted directly to the CT scan. I got some findings like this soft tissue shadow on the left nasal cavity, and the radio opaque shadow enclosed in this soft tissue. To sum up the findings, right maxillary sinus showed mild circumferential mucosal thickening and obliteration of right osteometal complex. Picture suggestive of right maxillary sinusitis. Mild right inferior nasal turbinate hypertrophy is small oval hyperdense focus is seen barely attached to the bony nasal septum and inferior turbinate. That recorded high density and was measuring about 0.5 centimeter by 1.5 centimeters. Okay. Some other findings were, let me see the next cut, please, of the CT scan. Some other findings was something like bone refaction in the medial wall of the maxillary sinus. So this put in mind many differential diagnoses. Can I have the next cut, please? Next slide, please. When we have this ramification or bone erosion of the right maxillary sinus, so we think about things like neoplastic lesions or inverting papilloma, or of course, fungal disease. Okay, next slide. So this was an element of infection and two dense foci of calcification. Okay. What happened during endoscopic surgery? During endoscopic surgery, minimal pathology was encountered in right middle meatus with little mucosal thickening, and a middle meatal antrosty was done easily. On right nasal cavity floor and under cover of the inferior turbinate, a firm, irregular pinkish mass was found. A firm, irregular pinkish mass. Okay, first step, I took a swab of the nasal discharge for microbiologic examination. Then, as we see, this is the turbinate. Okay, can I have the next slide, please? Next slide, please. I need the picture. Okay. Yes. Here we can see this is the floor of the nasal cavity and the middle turbinate and the immense partially covered by the inferior turbinate and this glazy discharge was taken as swab for microbiological examination. Okay, then mass was removed in pieces. With going on for removal, a hard ivory white piece was found. Although it was more or less adherent, يعني was not very adherent. It was manipulated, يعني gentle. It took some time, but gently it was manipulated and enucleated completely. And after enucleation, we got next slide, please. After enucleation, we got our surprise. Next slide, please. Next, please. No, next, please. Yes, this is the mass after. No, previous one, please. Previous one. The picture, use the picture, please. Previous, I need the picture, or last picture. This is the mass after partial removal. Yes, I need the picture. Previous. Yes, keep this slide. I need the picture, please. Yes, next. I mean the next picture, please. Yes, that's it. So removal, okay, and this is our surprise found inside this tooth with black granulation around. Okay. To conclude, nasal teeth are not common. Mostly they are ectopic teeth. They present as unilateral nasal obstruction. CT scan is a diagnostic tool. They are commonly associated with fungal infection. Surgical removal is the single and safest way to treat them. Okay? Some are thinking about differential diagnosis of such condition. Some are thinking about the dermoid cysts, but dermoid cysts are excluded from this. Dermoid cysts are excluded because we have certain areas or certain locations, common locations for dermoid cysts, like the jaw, maxilla, and mandible. Dermoid cysts in the head are recorded just at jaw, maxilla, and mandible. Okay, but no dermoid cyst was reported in the nose till now. Okay. Next slide, please. Okay, I want to conclude by the end that supernumerary teeth develop either from a third tooth bit that arises from the dental lamina near the permanent tooth bud, or possibly from the splitting of the permanent bud itself. Although cause of ectopic growth is not well understood, it has been attributed to obstruction of the at the time of tooth eruption. Other proposed pathogenetic factors include a genetic predisposition, developmental disturbance such as cleft palate, rhinogenic or odontogenic infections. By the end, I want to say that nasal teeth are not common. Mostly they are ectopic teeth. They present as unilateral nasal obstructions for smell. They are commonly associated with fungal infection. Surgical removal is the single safest way to treat. Thank you all. Thank you for nice attendance. It's now afternoon in Cairo, so I can say good morning. I say afternoon to all. Waiting for any question. Thank you.
Thank you, Dr. Osama, for the next.